And thanks for staying with us, everyone. Ghana has successfully completed the fourth review of its IMF program following a two-week assessment by a visiting IMF team that concluded last night. The country is set to receive $370 million upon completion of the executive board review. The government and the IMF have been addressing a joint press briefing. Here are excerpts of the conference.
This agreement, as usual, is subject to the approval of our executive board. And once the executive board completes the review, Ghana will have access to about $370 million, bringing the total IMF financial support disbursed under the arrangement since May 2023 to some $2.4 billion. Now, before we hear from the Honorable Minister and Governor Asiama, and prior to addressing your questions, I'd like to briefly outline some of the key points of our assessment and also our discussions with the authorities during this mission. So first, the external position has continued to improve with rapid accumulation of international reserves by the Bank of Ghana. And indeed, the accumulation of reserves has clearly outperformed the program objectives. Economic growth in 2024 was also stronger than expected. However, overall performance with respect to the program's targets and objectives deteriorated significantly at end 2024, reflecting policy slippages in the run-up to the general elections. Both the government's primary balance and inflation missed the targets. Several structural reforms have also been delayed, and some of the milestones in this area were missed. Fortunately, since then, the authorities have adopted bold corrective measures in several areas to ensure observance of the program objectives for 2025 and beyond. In particular, the authorities have adopted a raft of corrective policy and structural measures to address the budgetary implications and root causes of the 2024 fiscal slippages.
What rather started like the most difficult review of the program has ended successfully, with the IMF and the government of Ghana reaching a staff-level agreement on the fourth review today. This marks a significant journey in our collective effort towards resetting the economy for the Ghana we all want. We remain fully committed to the implementation of the program and will do all it takes to ensure that the objectives of the program are on track despite the challenges we inherited. Although there were a number of structural benchmarks and quantitative targets under the program that were breached at the time we took office, we have worked tirelessly to reverse the situation and in some cases fast-tracked the implementation of some key structural reforms ahead of their deadline and embarked on additional reforms. Ladies and gentlemen, to begin with, pragmatic and bold measures have been put in place to address the large payable buildup as at end 2024, which resulted in large primary deficit compared to the program modest surplus. These measures aimed at strengthening our spending commitment control system, eliminate the accumulation of payables, enhance budget credibility, and promote fiscal and debt sustainability. These measures include the following. 1. We have commissioned the Auditor General together with 2 international audit firms to audit the payable and commitment to validate their legitimacy and value and provide recommendations for collective actions.
All right, I'm joined on Zoom by Economist Professor Patrick Isumi. Good afternoon to you. So there were initial concerns Ghana may not pass the review because we had not met some key targets. Now the IMF passing us after its assessment. What does this say about the progress you are making towards economic recovery?
Good afternoon, Daryl, and good afternoon to viewers. Thanks for having me. Yeah, I think you are right that we definitely missed some of the program targets, as we've heard from both the finance minister and the IMF team. But I think the reaction since then, in terms of the kind of corrective measures that the current government has put in place, the 2025 budget that has been passed, trying to undo a lot of the slippages and bring the program back on track, and then also quick action to try and implement some of the structural reforms that had been planned. So you get the sense that the IMF looked at all of this and realized that yes, there had been problems towards the end of last year, but they would have been very impressed with how swiftly the government has tried to resolve those problems. I think that's why it didn't turn out to be a long, drawn-out agreement process.
Well, so they are also, we are going to be receiving $370 million after the board's approval, apparently. I mean, people are always questioning how significant that amount is, but what areas of the economy should the money be pumped to?
Well, I think when we read the budget, we see that we have a shortfall. So, first of all, once we receive those dollars, one of the things that help boost the results at the BOG received dollars, and then the government was spending cedis. So, I think it's not the kind of funding that you say you go to specific areas. I think it's just going to support the budget. If there's one area that the government should pay attention to, I think I've repeatedly mentioned that, is agric and food production. And we need immediate action, because if we are not able to make progress in this planting season as the rains come in, then the food crisis or the rising food costs will go up. But I think the government has already set its budget, and mostly these funds were just used to plug the hole in terms of the financing gap.
So what happens after this? I mean, what is the next phase of Ghana's program after this review? Would there be more stringent measures or adjustments?
So, well, I think you know that it has, at every stage, there are some targets to be met. I think since the start of the program, some of the target dates and additional targets have actually been added. So we hope and see. So depending on the progress and issues that come up there, the government together with the IMF, sometimes they revise the timetable and the schedule. But I think there's going to be another review, probably covering up to the first quarter or so. That will probably be done in July or so, and then we'll see where we go from there. But don't forget that there are still aspects that have to be done, especially even the debt exchange, the debt restructuring. Don't forget that it's been approved. The bilateral agreement is done, but we still have to do the country-by-country agreement. That part is not completely done. And we still have a small chunk of our external debt to complete the restructuring. The commercial part is not completely done. So all of those have to be done so that we finally bring an end to the debt restructuring. And then there are still a few structural issues that are yet to be addressed. The amendment to the BOG Act is still not complete. So there are still a few things to be done.
Yeah. Government, I mean, initially floated the idea of renegotiating the deal, hopefully, possibly extend the program. Do you see that happening?
I think it's going to be necessary. Now, if you look at what, so far, what this government is doing is more or less this 2025 budget is a correction. Now, the big issue about how far we will expand the revenue envelope, I don't think it's been done. If you look at the amount, the financing requirements, and how the debt restructuring push some of the payment back, I don't think that we've gotten to a position where a year from now we've been without substantial changes we'll be able to settle those debt. So let's see how the VAT reforms, what it will do, and by the end of the year how much we'll be able to expand the revenue envelope substantial basis. If you're able to do that, then maybe. But as of today, I still feel that some kind of extension will still be necessary.
All right, thank you so much. Appreciate your insights, perspective. Professor Patrick Esuming, economist, joined us for his take on the IMF passing Ghana on its fourth review. So the IMF mission chief for Ghana, Stefan Hode, has backed the recent increase in utility tariffs, calling it a crucial step to bolster the financial stability of state-owned enterprises, particularly the Electricity Company of Ghana. He made the remarks at a press conference following the two-week assessment of Ghana's IMF program.
As the government adjusts utility prices between on the one side, the importance of those adjustments to strengthen the SOEs in the sector and make sure that public finances overall are sustainable, and on the other side, the implication that it has, especially for the most vulnerable. And I think when we discuss with the authorities, we very much focus on these two aspects. So think about the electricity price increase that PORC has announced recently. On one side, it is very necessary to strengthen the position of ECG, so that ECG in turn is able to pay its bills to the power producers, and that in turn you, as Ghanaians, continue to have access to electricity on a continuous basis. So it's very critical from that standpoint. From the standpoint of the implications on the poor, on the most vulnerable in Ghana, of course, this is something that we are not only very mindful about, but also we want to make sure, and the government actually wants to make sure, and we support the government in implementing policies that enhance and that increase the transfers towards the poor and increase social protection, precisely to put the most vulnerable in the country in a better position to face higher inflation, higher costs. And this is what has been done since the beginning of the program. We actually have conditionality to monitor implementation of those programs. The 2025 budget has continued with these policies by significantly increasing for example, the benefits, the LEAP program, the capitation grant, etc. All of those social programs that are very critical to that endeavor.
So watching the marketplace, some news we are following for you. The Chamber of Mines has issued a press statement noting that it is concerned about the recent rejection by the government of Ghana of the Damang Mines lease renewal application submitted by Goldfields. The Chamber recognizes the government's prerogative in the granting and renewal of mining leases, which are critical for the sustainable and responsible development of Ghana's mineral resources. However, it says it believes that the decision of this nature has significant implications for the mining industry, investor confidence, and the overall economic growth of the nation. The mining sector, it says, remains the most significant contributor to Ghana's economy, providing substantial employment, foreign exchange earnings, and revenue for national development. In 2024, for instance, it says gold exports resulted in export revenues of about $11.5 billion, and this represented over 50% of Ghana's total export earnings for that year. In effect, it says it is important that in addition to the direct effects of such decisions, the unintended consequences are also carefully considered so as to avoid outcomes that could be negative for all stakeholders. So there you have it, the Chamber of Mines giving an official response to the denial or rejection of Damang Mines lease extension by the government to Goldfields. The chief executive of the Chamber of Mines speaking to us yesterday saying this could have very negative outcomes for the mining sector. You're watching The Marketplace, the exchange up next. All right, thanks for staying with us on the marketplace. Time for the exchange. Now, drone logistics are playing a growing role in improving access to essential medicines, enhancing healthcare system responsiveness, and saving lives, especially in maternal and emergency care. A recent study by Zipline Ghana and the Ghana Health Service found a 56.4% reduction in maternal deaths at healthcare facilities served by the drone delivery system. Daniel Kwekumaki, country lead for Zipline, joins me in studio to talk about this. Good afternoon to you. Thank you for joining us for the exchange. Happy to have you. And so I want us to first talk about, for those watching, wondering what the medical drone delivery system is, maybe you could shed some more light.
I mean, when you look at the drone delivery system, I think the first thing I would like to say, we don't have to look at it as drone deliveries. It's a piece of infrastructure.
Right.
And when you look at it globally, like Zipline is in 8 countries, 5 in Africa. And in terms of having that infrastructure, Ghana has 6 distribution centers. And by miles flown, by the deliveries done, is actually the largest autonomous delivery system in the world. So just to reiterate or keep it short, basically, drone deliveries or aerial logistics is a system with which we can deliver not just medical goods, but in Ghana's case, medical goods more efficiently, in a timely manner, and with systems that are deeply integrated into the needs of rural areas as well.
Yeah, I remember when this became a thing in the country, people started talking about it. Since then and now, talk to us about how that has helped reshape healthcare.
Okay, thank you for that. I think we came to the country in 2019. So there's multiple facets. There is where we had the COVID-19, and one of the reasons why Ghana was getting a lot of the vaccines was because we actually had the system to really deploy it across the entire country and even into rural areas. Now, in addition, so when you go on the vaccine front, we have done more than 16 million doses delivered. Or in terms of, we deliver medicines, we deliver blood system. So we have really had like a severe impact, more than 700 life saves, a lot of immunization rates that have improved. But I would also like to say that actually when we deeply integrated with the government system and drive it as a holistic system, we could have actually far more impact.
Yeah, hopefully we have time to talk about public-private partnership, and that can help going forward. But a study that caught my interest was about how, like I've said in the intro, 56.4% reduction in maternal deaths as a result of this in the Ashanti region, I'm told.
Yes, exactly, in the Ashanti region. And I think the surprising parts about the studies is twofold. The first thing that I would like to highlight is the study was done comparing health facilities with Zipline and without. So you could see that 56.4% increment in maternal deaths avoided in the health facilities that were served by Zipline. And one thing that even surprised us was that one of the reasons why we had that impact beyond the accessibility was actually that the visits increased because the patients, the women knew that blood would be available, critical medical supply would be available. So we increased like hospital visits by 20%, and in-hospital deliveries increased by 25%. So not only did it change the way we could deliver the drugs and the medicines, it also changed actually the patient behavior.
All right, one more minute. I'm told I have to wrap up. See, we're seeing this model yield results. And so how do we encourage public-private partnerships? I mean, you've partnered with the Ghana Health Service, for instance. Yeah. How is that going to help give us very positive outcomes when it comes to improving healthcare?
I mean, as a company, we have been kind of course, leading the advocacy of our own cause. But I think to studies like the one in the Ashanti region on the maternal mortality rate, but then also we had a study in Western North on immunization of children. I think right now it has proven to work within certain regions. So I think what we can really do together with the Ghana Health Service, with the Ministry of Health, is kind of just expand and replicate that. And then also have a system where, in addition to deliveries, we are also utilizing our capacity in terms of getting the right data so that government can really strategize, use this to have the most high impact deliveries, and then also feed into their own agenda. Be that, of course, on the healthcare system side, but you can look at 24-hour economy. It would be a very efficient system, for instance, to do deliveries at night. And there is far more opportunities there.
I didn't think about that, the 24-hour economy. Yeah. Country lead for Zipline Ghana. Thank you so much, Daniel Maki, for joining us on the marketplace. There is more news on our website, myjoyonline.com/business. Thanks for watching. We'll be back same time tomorrow.